Hello, my name is Caitlin Laughlin, and today I'm going to be telling you about my report on vasovagal syncope. So now you're probably wondering, what is vasovagal syncope? Vasovagal syncope is caused by a sudden drop in blood pressure. Often, this is your body's way of responding to certain triggers. We will talk about those triggers later on in this presentation. This causes your heart to slow down for a short time or a short period of bradycardia. As a result, your brain may not get enough oxygen-rich blood, which can cause you to pass out or faint. Vasovagal syncope is typically not a serious health condition, and the episodes only last a few seconds to maybe a full minute. Another name for vasovagal syncope is neurocardiogenic syncope. The breakdown of the word neurocardiogenic is neuro, which means nerve or nervous system, cardio, which means heart, and the suffix genic means producing or forming. Syncope literally means temporary loss of consciousness due to insufficient blood flow of the brain. Now we're going to talk about some of the warning signs of a vasovagal attack. If you look pale or lose color in your face, this could be a sign of a vasovagal attack coming on. Also, if you experience lightheadedness, dizziness, nausea, blurred vision, weakness, clamminess, or sweatiness, this is also warning signs of a vasovagal attack. If you experience these warning signs before fainting, it is a good idea to lay down to increase the blood flow to your brain. This may or may not prevent you from fainting. Can you prevent a vasovagal episode from happening? You can't always avoid having an episode, but there are some precautions you can take when you feel like one is coming on. These precautions can reduce the chance of further injury or help the episode along. You can lie down wherever you are and try to get your legs elevated. Or if you are unable to lie down, you can take a seat on the floor and put your head between your knees. These actions allow gravity to keep blood flowing to your brain. You really want to be able to help your brain get the adequate amount of blood flow by getting gravity on your side. As we talked about earlier, there are certain triggers that can cause a vasovagal syncope. There are many things that can cause this to happen, including harsh straining, severe pain, sight of blood, heat exposure, intense physical pain, and even having great emotional stress. All of these factors can cause your nerves to send message to your heart telling it to slow down, and this is why bradycardia occurs. And with this, your heart is unable to pump enough blood to the brain. Now we're going to talk about what to expect during and after a vasovagal attack. There are many things that happen during and after a vasovagal attack. For example, during one, you may have a weak pulse, you may experience jerky or abnormal movements, small inaudible noises, blacking out, and dilated pupils may occur. After a fainting spell, you may experience physical and mental exhaustion, nausea or vomiting, lightheadedness, sweatiness, and confusion. Now we're going to talk about some commonalities on vasovagal syncope. It is so common that it was reported that up to 50% of people have experienced a loss of consciousness at some time during their lives. The most common age that vasovagal syncope is present is at around 13 years of age, and there seems to not be a lot of study on if it affects one gender more than the other. And lastly, here is my list of references that I used to create this presentation. Thank you for listening.